Foam rolling involves a technique which, in all probability, is somewhat similar to massage, where you're using a roller, if you will, which is typically made of some sort of synthetic plastic, and you're applying a compressive force to a tissue. So, for example, one of the more popular indications is in runners or other athletes who have problems with their iliotibial band, which runs along the lateral side of the thigh. And so the idea is by rolling back and forth across this roller that you're applying some compression to the tissues, and that may in fact help them to relax, and it may actually produce structural changes to the tissues over time if it's repeated. Can this be a tool for injury prevention or for injury treatment? And I look at it much like stretching. Some of the work that we were involved with 20 years ago was really asking the same question, right? Is stretching protective against injury? And in fact, if you have an injury, for example, a hamstring muscle injury, is stretching beneficial? And it turns out that it's probably a little bit of both, that for both injury prevention as well as injury treatment, that a lot of these techniques, if you will, are probably quite useful. I think the take-home message there is we still have a long ways to go. There's promise, at least in the clinical literature, that this works, and I think we see it with our athletes and our everyday patients. You know, they will tell us anecdotally that it does seem to help them.
It seems to ease the recovery process. It kind of makes it a little quicker, and you're not always sore. You know, it kind of alleviates that soreness that a lot of us will feel when we change a workout or we start working out again. Definite benefits to it.
This has certainly become a somewhat popular technique, again, both for injury prevention and then even in the recovery period, regardless if they have an injury or not.